Hello and welcome back to today's Global. UNICEF has warned that the drought in Somalia is causing at least one child to be admitted in hospital for malnutrition every minute. That threatens to cause deaths of children on a scale not seen in half a century. Well, the current drought is a result of 5 failed rainy seasons and is affecting nearly half of Somalia's population. Pressure is now mounting on the authorities to formally declare famine in order to facilitate an emergency response. Well, the worst affected parts of the country are largely occupied by the militants from Al-Shabaab, who've curtailed the humanitarian response so far. The drought, which is linked to climate change, is the worst to hit the country for 40 years. Well, let's talk now to Victor Chinyama, UNICEF's Somalia spokesman. Thank you so much for joining us here on today's programme. I'll return to that headline phrase from UNICEF today: one child being admitted every single minute. That's both horrifying and alarming, isn't it?
It is alarming. The amount of suffering is unlike any that we have seen in the past. And even if you compare to the drought in 2017 or famine in 2011, what we are seeing now is on a different scale. And simply because it's gone on for way too long, as you said, 5 rainy seasons of no rains whatsoever have decimated people of their livestock, of their crops, and have forced them to flee their homes in search of help.
That phrase of one child being admitted for malnutrition every minute, that is bad enough, but it probably doesn't take into account that mothers are having to walk for days to actually get to a medical facility. So the reality is probably even worse, isn't it?
It is worse. I'm right now in a town called Dolo, which is one of the most affected. And I have spoken to a mother that had to walk for 10 days, 600 kilometers. And she got here, unfortunately lost 2 of her children. And this is only one of many stories that we're hearing of families that are having to walk hundreds and hundreds of kilometers in search of food, in search of help. And it is a disaster. These are people that have hopes and aspirations, and unfortunately have been caught up in a really, really difficult situation. The amount of suffering is just unimaginable.
It is, and when you tell a story like you just have, it really hits home. I mean, you are very seasoned in this sort of work. Even for someone like yourself, does it shock you what you are seeing with your own eyes?
It does. And just when you think that you've heard it all, it gets worse. And to sit there and talk to mothers who have not eaten for days, who have nowhere to sleep, and whose children are going hungry at the risk of severe acute malnutrition, it's just so gripping. And I have seen many, many situations, as you have said, but this is unlike anything I have seen throughout my life with UNICEF.
So what is most needed? Is it food aid? Is it money? Is it the world's attention?
A combination of all of those things. At the moment, we really need to provide food and to communities that are hungry. But at the same time, we need to find and treat children with malnutrition. That is really worrying us a lot, because we're seeing the numbers going up. In fact, what we are seeing this year, from the beginning of this year in January up to about August, it's double what we saw in 2021 as well as 2020 in terms of the numbers of children that are being admitted with acute malnutrition.
How much more difficult is it to actually get to those people you need to get to physically, geographically, because of the security situation?
That is always a factor. Access to many of these places, as you know, is very limited because of insecurity. However, we are not sitting back. We're finding different ways of providing aid, primarily through our Somali partner NGOs that are able to go behind the lines, reach people and provide them with support. However, what we are also seeing that a lot of the people are coming from these inaccessible areas to some of the major towns like Dolo here, where they can receive help.
And what is the window of opportunity, if I phrase it that way? How fast is that actually closing?
We are up against it. It's a race against time. We have been warning about this crisis from as far back as November last year. And I'm afraid the numbers that we are seeing are really shocking. And it won't be a surprise if, with the new data that we expect to come out possibly next month, that some of the areas are already experiencing famine-like conditions.
I said in the introduction, it's still officially not been declared a famine. Should it be? And what difference does that actually make for someone like you who's there on the ground trying to help? Does it make any difference, an official declaration of what you're experiencing already?
At the moment, we're not waiting for the famine to be declared, because we know from 2011, for example, that by the time that was declared, almost a third of the people that died had already lost their lives. So we're not waiting. We are scaling up our response. We are aiming to reach people as though we are already in famine. Now, we will not need to wait for that to be declared. And we know there's a whole process that needs to be done that is informed by data. However, based on simply what we are seeing now, we are responding. We are in an emergency here.
Victor Jinyama there from UNICEF. Thanks for being with us and thanks for describing what you're actually seeing and dealing with so graphically. Thanks so much for your time.
Thank you. Most appreciated.